Welcome to the Springs in the Desert podcast. We're so happy that you're here with us. We're those friends that you can take with you wherever you are on the path of infertility.
Hey everyone. Hello and welcome to the Springs in the Desert podcast. I'm Anne and I am joined by my friend and my Springs in the Desert teammate, Cassandra. Hey Cassandra.
Hi.
Well, we are so excited today to bring on a special guest and a really good friend and contributor of Springs in the Desert, Caroline Gindhart. And in a moment, I'm going to let Caroline introduce herself. But, you know, we talk in Springs in the Desert about how our mission focuses on Christ, not on conception, right? So we are offering that spiritual and emotional support and accompaniment. We're not focused in on treatment and getting pregnant and those kinds of things. But of course, we support people wherever they are on this path of infertility. And so we want to be that accompaniment, whether or not you're seeking treatment, if you're taking a break, you have a diagnosis, if you're entering into menopause, you know, wherever you are on that path. But inevitably, we get questions about treatment, discerning treatment, just kind of how to manage your thoughts and your emotions and physical side effects when you're maybe taking medications and all of that stuff. So we want to talk with Caroline about that because she is a nurse practitioner who works at an office, a NaPRO office here close to me where I live in central Pennsylvania. And so we want to talk with her about some of those issues around treatment, discernment, taking a break, and a lot more. And we also want to talk about how we can really have a better relationship with our own healthcare providers so that we feel really heard and understood in the midst of something that is often just so chaotic for us. So we want to welcome on Caroline. Thanks for being with us.
Yeah, thank you so much for having me, Anne and Cassandra. It's a privilege to be here with you guys. I love working with Springs in the Desert. It's so fruitful for my patients, you know, when I give this information to them, because I can't always address as to the extent that I would like their mental, emotional, and spiritual health. But as Anne said, I am a nurse practitioner at a NaPRO clinic in central Pennsylvania, Divine Mercy Women's Health. And I've been a nurse practitioner for about 3 years now. I went to nursing school at Penn State University. I pursued nursing because I have 6 younger siblings, so I grew up in a big Catholic family, and I just love taking care of my siblings. And so I knew I wanted to pursue something that utilize those talents and those loves. And so I went to nursing school. And then when I was a sophomore at Penn State, I read a book called The NaPRO Technology Revolution by Dr. Thomas Hilgers, who started NaPRO technology. And after I read that, I knew that's what I wanted to do with the rest of my life, because I had this love for theology of the body. I was thinking about even studying theology when going into college. I had this love for theology of the body and a growing love for women's health. And it merged the two. And I had my own kind of cycle issues. And so after I read that book, it just made so many of those cycle issues make sense. The doctor wouldn't have put me on birth control when I was 13 years old. And, you know, luckily my mom didn't let that happen. And so it started to make things make sense. And so after I went to nursing school, I worked as a mother baby nurse and went to nurse practitioner school straight after nursing school, and family nurse practitioner school. So kind of a wide education there. And then after NP school, I went and did a fellowship training at the St. Paul VI Institute in Omaha, Nebraska, because I knew that going into medicine that I was never going to prescribe birth control or, you know, practice in a way that was contrary to Catholic teaching. And so I wanted those tools right away. So I am a fertility care practitioner. I teach patients how to chart with Creighton model and then treat them with medical NaPRO technology. There's a surgical aspect that our physicians do, but I just do the medical side of that. So I worked in family medicine for a year and a half, and then I started with the group I'm with about a year ago. And so that's where I am today.
Well, thank you so much, Caroline. And we're certainly glad that you are here with us today, because just from getting to know you over this last year or so, and the contribution that you've been making to Springs in the Desert, it's just so evident that you have a real heart for what you do. I almost said for your ministry. And that's because I almost feel like what you do in your job is sort of a ministry. Can you talk to us a little bit about the patients that you see, especially those who are dealing with infertility? What are the kinds of sort of emotions or the things that they most often express to you as they're going through this?
Yeah, absolutely. And yeah, I mean, thank you for saying, I do see what I do as a ministry. I see it as a very specific call from God, not something I imagined for my life. I mean, I love what I do, and I'm privileged and blessed to do what I do, and I love it. But it's not what I thought I'd be doing with my life. And so it's all God. And so he's the I'm just the hands and the feet. he's the one behind it all. But when I first see a patient, I have patients that, may have been struggling for years and years with infertility, and they are just, it's something that is so hard to talk about and to seek help for, especially if you are Catholic and knowing what the church teaches about in vitro fertilization. And just if you go to your primary care provider, your OBGYN, they don't do much of a workup. And so then feeling like IVF is the only option, but I don't want to do that because that's against church teaching. And then somehow they find me, whether it's usually through word of mouth by friends, or, maybe they heard something on a podcast or saw something on Instagram. So they come with a lot of just like trepidation almost, because it's such a hidden cross. It's hard to share with family and friends, especially if they're not having any issues becoming pregnant and they have growing families. So they just come with a difficulty in, sharing that, or maybe they come with feeling like that they've been, gaslighted by their medical provider, where they just haven't been listened to and their concerns haven't been taken seriously. It's not uncommon for me to be reviewing labs and say, well, did your doctor ever tell you this was abnormal? And they'll be like, no, like they told me everything was normal and I have unexplained infertility. And so I say, I've never diagnosed someone with unexplained infertility. And so they come with just like a need to be heard, and just kind of anxiety about, the treatment process. And so that initial kind of visit is overwhelming, and that, I just ask a lot of questions, and then I lay out kind of all of the testing that I'm going to order. And so those first 1 to 2 cycles is very intensive on testing, frequent ultrasounds, frequent blood work. And then, we sit the next appointment and just go over everything. And there's usually more than one things that I find that are contributing to the infertility, because in NaPRO technology, we recognize that infertility is a symptom of an underlying disease. It's not a disease in and of itself. And so I get to the root of the problem and treat it in a way that cooperates with their natural cycle, rather than shutting it down or trying to, go around it, through IVF or something like that. And so those visits can be overwhelming, and that I'm just sharing all of this information. And so it can bring a lot of anxiety too. And we treat the men as well. We do seminal fluid analysis, sometimes urology evaluations or evaluations by their family medicine providers. So it can just be a lot of information to take in. And then there's, this, excitement about, knowing like, okay, these are the things. And so I just have to do X, Y, and Z. And this is how, I can become pregnant. And then, if it's been, months and with no pregnancy, it can start to be draining, because there are so many kind of emotions that go on during the cycle. That's why I talk to my patients a lot about like mindfulness, and especially mindfulness in charting. When you're looking at your chart, identifying what are the emotions that I'm feeling right now, and how does that correlate with where I am in my cycle? Because I see a lot of women go through these cycles of emotions, and that, there's around the time of fertility, there's a lot of pressure to perform, that this is the time that I'm fertile, so this is the only time that I can become pregnant. And then there's that anticipation of, am I pregnant this cycle? And, if I get to this certain day, then I can take a pregnancy test, or maybe even taking serial pregnancy tests because you're just anticipating. And so that can cause a lot of anxiety. And then if you don't become pregnant that cycle, then a mourning, a grieving process that happens, that you're grieving that you did not become pregnant. And so that wears on you cycle after cycle after cycle if you're not becoming pregnant, and to just go through all of those emotions. And you have to make a lot of lifestyle changes too. You're taking a lot of different pills. You might be changing your diet based on what the underlying condition is. I recommend different diets. And so it can feel like a lot. And especially if I see this in couples frequently, in that, we treat both men and women, and it's usually a combination of the two. And so I work on optimizing both fertility. Sometimes, though, it's more obvious, like which spouse has more underlying conditions that may be contributing. And so you can start to feel like you're the one doing all of the work, and then your husband or wife, like they don't have anything in particular, and you're eating gluten and dairy free, and then your husband's next to you like eating chocolate cake and drinking a glass of milk, and like just not feeling like joined in that. Or I heard, and I hate when couples say this, just because it's so hard when they say like, oh, I'm the problem, and that just breaks my heart when I hear that, because it's both of your fertility. When you get married, you become one flesh. And so it's both of your fertility together. And so it's not just a you problem or a him problem. This is both of your fertility. And so there can be this tendency to, feel like it's all on you. And it can start to create resentment between couples too. I've even, seen that in visits where there's just resentment, and that it's, they're the one with the problem. And so there's just different cycles of emotions. And so it's an intensive anxiety. It can be anxiety provoking treatment process.
Yeah, Caroline, there is so much in there, in everything that you just said. I mean, I think so much good stuff, and so many different directions we can take this conversation with what you said. But there are some things that stood out to me, and Cassandra, I'm sure there are some things that you picked up on too. One of the big ones for me was the language that you have been using throughout. That's something that I'm particularly sensitive to, and something that in this ministry we try to be really sensitive to. So, for example, you talked about underlying conditions or infertility being a symptom of a disease. Though, that kind of language I think is important for us, not just in this ministry, but as we encounter people who are dealing with infertility, and the kind of language I think we need to hear from our healthcare providers, because we can tend to see infertility as a problem, and even not just a problem, but like a personal failing. I think probably many times the woman especially will think to herself, if not for me, obviously we know that there can be certain underlying conditions like male factor infertility. But I think as women, we sort of put it on ourselves very often. So I really appreciate the language and the sensitivity that you use.
Yeah, absolutely. Because when we suffer with anyone who suffers with a chronic disease, even outside of infertility, whether it's diabetes or, heart disease, you can start to identify yourself with that disease. Like, when I was in family medicine, I never said, oh, he's a diabetic. Like, you're not defined by the condition that you're suffering from. But it can be very easy to feel defined by that. And so I never, say that you're an infertile person. Like, no, you're struggling with infertility. Like that does not define you. And so, yeah, I'm very careful about that, because I think the language that we use, it does make a difference.
Yeah, I was just thinking about, while you were talking, about how hard it is to give up control, or the illusion of control, I think, that we all kind of have, and at least try to do things God's way, because I feel like with those artificial reproductive technologies, the ones that go against our Catholic faith, I mean, I don't have personal experience with it, but I feel like, at least I have to do this, and I'm doing this, and we're going here, and this is what we're doing. But when it comes to the point where it's like, God, please heal my body, it's, entrusting our health and bodies and those underlying conditions that we struggle with to God, who's the author and giver of life. And I feel like so often, and not just with infertility, it's like we try and are struggling just to do things and be in control and whatever. And finally we come to this point where it's like, I can't, God, I need you to help me, So I just really appreciate that holistic aspect of NaPRO.
Yeah, absolutely. And I think we say, like, knowledge is power. And so we have all of this knowledge about all of these things that could be contributing to the infertility. And so there does feel that sense of control, like, I know what's going on and I know what can fix it, so I can do that. And even as a healthcare provider and, someone that's just very type A, I struggle with, feeling, in control and things like that. And I have to really balance that with, like, this is a person, an individual person in front of me that has, individual needs, and this is a working relationship. But yeah, I think as, women especially too, we struggle with, feeling, because we've been given this amazing ability to, like, care for other people. Like, that's built into our femininity. And so we want to just take care of everything and everyone. But at the end of the day, you're right. Like, there's a God piece. And I tell my patients that, like, you and I can only do so much, but the other piece of it is God. And, like, he'll use things that he doesn't want us to suffer. He doesn't inflict suffering on us, but he'll allow us to go through difficult things if it means coming closer to him. And so it can be something that can, help us to let go of control and let him kind of satisfy our needs and take care of us.
Yeah.
Yeah, those are great points. And before we take the conversation in some other directions, I want to go back to, again, that language and you speaking about infertility as a symptom of an underlying disease. And I think that's an important point to pause on, because when we're struggling with infertility, we can be so focused on that, on optimizing the fertility and that goal of becoming pregnant. And I know this was my experience. There came a point where I didn't even really care about my health. Like, I didn't even care if, any of these things that we were doing was going to help my body. It was all about my fertility. And so it's important for us, especially I think as women, to know that, like, God wants us to be healthy, and that should be sort of the first thing on the list, that it's good to pursue things that will help us to be healthy, to restore us and restore our bodies as best we can.
Yeah, absolutely. I tell patients the same thing, and that, we're trying to help you become healthy, and naturally that's going to help to enhance your fertility.
Yeah, so important. Well, there are so many things that we want to talk to you about. But one of the things that we wanted to talk about was really how we can have a good relationship with our healthcare providers and how we can better communicate with them. I remember when we moved from Philadelphia here to central Pennsylvania, and I got a new doctor here. By that time, I didn't know it, but I was only about 2 years away from having my cycles stop. So, I was in my late 40s. I didn't know how close I was to kind of the end of the road, but, we still kind of had that hope. And I remember the first appointment at this practice, filling out all the paperwork and having the nurse come in first and look over everything. And I remember she said, really, matter of factly, or, well, I'm a very sensitive person. So the way that I read it was in a kind of like shaking her head sort of way. I see that you're on prenatals. Why is that?
Mm.
And again, I'm a very sensitive person, and I know that there are other women who are sensitive too. And maybe it didn't mean anything. Maybe she was just gathering information. But at that point, it was so raw. It had been so many years that we were trying, and I could hear the clock ticking really loudly. And honestly, I just never went back after that appointment. And so, how can we better communicate, or what could I have done? What could I have said that wasn't sort of getting angry and kind of going off on her? But what are some ways that we can communicate with our healthcare providers when something like that happens, when we feel like we're not heard, or when we feel like we've been spoken to in a way that is unintentionally perhaps insensitive?
Mm-hmm. Yeah, I want to first just apologize that was your, experience, because, we as healthcare providers can, say things that are insensitive. And, I'm not going to make any excuses for that. But you should be treated in a way that, with dignity and respect. And I tell my patients from the first visit, like, because I feel like, I give them time to talk, and then I start telling them about, what I see as, my concerns and what I want to do for the treatment process. And then I tell them, like, how does that sound to you? I don't want to dictate a treatment plan. I want this to be a relationship in which, if I suggest something, that you tell me like, no, I'm not comfortable with that. And so a lot of this falls on the healthcare provider to be able to sit and to listen and to hear what your intentions are, how aggressive you want to be, and the points that you're uncomfortable with certain treatments. And so it can be intimidating to kind of bring up concerns to your healthcare provider, especially because, we went through a lot of training and we have a lot of knowledge, and, patients are great in that they do a lot of research on their own, and they do equip themselves with knowledge. But there are a lot of things that they aren't aware of. And so it can feel very intimidating to approach, the quote unquote like experts with like concerns, and like never feel like it's not that you're not trusting of your healthcare provider. Like, you're the one that is in the driver's seat. Like, this is your one beautiful life, and I'm here to help you with your beautiful intention of, building a family. And so, if, after a while, you start to feel like that the treatment process that we talked about, it should be healthy. It should make you healthy. It should be life-giving. If you start to feel like it's not in some way, like it's affecting your mental, emotional, physical health, or your spiritual health, or affecting your relationship with your spouse, then that's a really good time to kind of take a pause and say, the treatment process is supposed to be healing to all of these parts of me. It's not. And so that's a time to, really look and say, what are those things that, are causing me stress? Is it the number of pills that I'm taking? Is it side effects from things that I'm taking? And so it's good to kind of sit with that and to really identify, to have a good self-knowledge, and to identify, like, this is the way I'm feeling, and this is why I think I'm feeling that way. And so bringing that up to your provider and say, hey, I'm feeling really anxious, this time in my cycle, or, when I'm taking this medicine, I feel this way, or like I no longer enjoy food. I eat gluten and dairy free, and I'm eating an autoimmune paleo diet, and like I don't enjoy food, and I feel really guilty if I like eat something that I'm quote unquote not supposed to. And so just really identifying like how you're feeling, and then asking the brave question, because it is a brave question of, you know, what is something that, what are some things we could discontinue maybe, or if I wanted to take a break for a while, what would that look like? Because, you know, a lot of the things that we use to treat, they make you just feel better. You know, if you suffer with PMS, correcting your hormones is going to make you feel better. And so when someone comes to me wanting to discontinue some things, I keep them only on the most necessary things to make them feel good. And so asking, you know, what if I took a little break, what would that look like? You know, what things should I, you know, discontinue? Or are there like, I'm not even sure why I'm taking XYZ supplement, you know, because I'm taking this long list. They're in my pill box and I just, you know, take them back every single morning, you know. And so asking, like, I'm not even sure why I'm on this. Like, can you explain that to me? And so just really bringing like open-ended questions and being honest and not feeling like I'll be disappointed in you. I had a patient recently. She was like, she's entering her 40s, not sure if she wanted to continue treatment. She had, you know, adult children and or teenage children, but still wanted another child. And she was just really kind of on the fence if she wanted to continue treatment or not. She was like, I'm just so afraid that like you did all of this work to help me. And then what if I decide that I don't want to get pregnant anymore? And I'm like, please don't, you know, fear that. I was like, what we're doing is optimizing your health. We're helping you to be healthy, you know, treating your prediabetes and X, Y, and Z. And, you know, don't ever fear that I'm going to be disappointed in you if I've done quote unquote all of this work and then you decide to not pursue treatment anymore. Like my desire is, you know, whatever, you know, yours is and your intention for your family, that's very individual. And so if a patient brings up to me that they want to take a break from treatment, I mean, my response is usually like, are always rather, you know, not, I'm trying to think of the right word, not like congratulations, but I'm just impressed and in awe that like they have such a strong desire for a child, which is a beautiful, holy desire. But they've taken time to reflect and realize that this process isn't life-giving to them and that it's affecting some aspect of their life. And so that's very brave to recognize that and to bring that up. And so I congratulate them. I'm, you know, in awe of them when they're brave enough to bring that up, because we're seen, I think, as healthcare providers, and, you know, I can kind of get into this too, is like, you come to me because you want to become pregnant. And so that's kind of what my focus is. And I don't always, you know, check in with how they're doing emotionally. If in a visit, I see that a patient is struggling with something, then I really open it up to that. But it's something that can be hard to bring up because you're there because you want me to help you become pregnant. And so you can feel like you're, you know, giving up hope or, you know, a failure. And those are the farthest things from the truth. And so I just encourage you to, if that's, you know, if you're on the fence about, you know, continuing treatment or not, or taking a break or not, to just bring up your concerns in honesty. And I know I can only speak for myself, but when patients bring up that conversation, I am so happy and so thankful that they trust me enough to let me into that intimate part of their hearts and their lives, and that they feel comfortable enough with me to be honest with me in that way.
I'm so grateful for everything that you just said, Caroline, because I think we can get that thought of, are we disappointing our healthcare provider? They're doing all this work to help us, or, you know, just our emotions are all over the place when we're going through this, especially if it's been a long road for us. And so I really appreciate everything that you just said to encourage us, if we're going through treatments, to be empowered. Like, this is about our health, our marriage, our family. We don't need to sort of please anybody else. We need to do what is good for our own health and for our marriage and our family. So I think that's a really important message to get across.
Yeah, and we can't, we talk about the relationship with the self, with spouse, and with friends and family and God. And, especially with our relationships with our spouse, if all of this treatment is doing damage there when all we're trying to do is like become co-creators with our spouse, but it's just creating such tension, I think that's probably a sign that maybe it's time to kind of breathe some life back into that relationship too, because I feel like it's not my personal experience, but it must be really easy to just start reducing people to parts. I know, and that's something we talk about a lot. And but yeah, just to keep our eyes, not to turn together like towards our spouse and like be butting heads with our spouse all the time, but to turn, and side by side walking together towards God, throughout this path. Is so important.
Yeah, the time is flying by. We just have a few minutes, but since Cassandra mentioned our spouses, our husbands, for those of us who are going through these treatments, or if we're trying to discern that, do we need to take a break, or, where are we in all of this? And of course, the charting, which can be really kind of stressful in its own way. Caroline, from your experience, how can husbands be sort of more involved in this process, in the charting and the treatment and all of that? Obviously, you mentioned that you may treat men, there's testing and supplements and even surgery in some case. But so often all of this is focused on the woman. And of course, it's the woman's cycle that is being charted. So how can husbands not just sort of, oh, I'm supporting my wife, but really feel a little bit more like they are part of it? Because as we talked about at the beginning, it can feel like this real separation, like everything is on me, I'm doing it all. And how can we as women invite our husbands sort of more into that experience, which I think can maybe help to strengthen that communication and that bond?
Yeah, absolutely. Yeah, because a lot of it is our cycle, that we're treating. And, our husbands can't make our, mucus observations for us, or take pills for us, or, any of those things. And so it naturally kind of a lot of the burden does fall on us. And so I would encourage men to, ask frequently, like, ask your spouse, like, how are you doing with this? And, I always, like I mentioned in the beginning, the chart, when you're looking at your chart, is a great place to bring up that conversation, depending on where you are in your cycle, because we talk about, talking about, the fertility of the day, and talking about what your kind of intentions are, but kind of bringing up how you're feeling about that. And just ask your wife the question, how can I help and support you? And so women can feel alone in this, and like they're doing all of this work and, feeling resentful. And so one thing that I encourage husbands to do is to, eat the same diet as your wife. The diet that she is eating is going to just be good for your health. Paleo Mediterranean diet, it's, good for preventing diabetes and heart disease and all of those things. And so if you're suffering in that way with her, something that you don't necessarily have to do, but something that, can build resentment if she's doing all of these things and it looks like you're not doing anything. That's something that can help to kind of bring you into that, or doing the charting for her, or just going to appointments with her. And being engaged, and asking, how does this make you feel about this? Just really open-ended questions, because at the end of the day, as women, one of our biggest desires is to be heard and to be understood and to be loved. And so, a little bit goes a long way. It doesn't have to be something something crazy, just kind of asking her how she's feeling with this and the ways in which you can help to support her and love her through this process, or I think would go a long way.
Yeah, I agree with you. And I think from our point of view, checking in with our husbands too, and just asking them, how are you doing with all of this? Because I think on their part, it can sometimes be difficult to watch us go through the things that we have to, or just that experience of sadness and grief that we might have, and to feel kind of helpless, because I think more than anything, our husbands want to just be able to make us so happy and healthy. And as Cassandra said at the beginning, like, that's not all in our control. So I think it's, very much what you said, Caroline, about just that communication, and just talking with each other and checking in with each other, and seeing this as a cross that we're carrying together, but also as a way of being fruitful together too.
Yeah, I was just thinking about how maybe sometimes for us as women, and what I meant before in that it wasn't my experience, not was that I never butt heads with my husband, but that we kind of went straight to the end of the path of it. It's like someone turns off the podcast right then, like Cassandra never butts heads with her husband. But anyway, I was just thinking about how my husband, didn't have to physically really go through anything, but just thinking about him and my first surgery, when we found out that I had an ovarian cyst before we knew it was cancer, how the surgery was supposed to take 2 hours and they were in there for 6 hours. And just him in the waiting room getting these text updates like everything is proceeding as whatever expected, whatever. But obviously it's not, 6 hours later when they were in there dealing with all the endometriosis that no one knew was in there. Just this kind of silent suffering and witness of the husbands, I think, in this scenario, and how it is really rough, I think, to watch the person you love have to take handfuls of supplements and inject herself and do these surgeries and things, and that it's not helpful to think that like my husband doesn't have to do any of this, but that we're just kind of in it together in a different way.
Yeah, amen. Always just communicating, praying, and knowing that like this is a marriage. Like you said at the beginning, Caroline, the two are one flesh, right? You're in this together. Gosh, the time flew by. There's so much more we could talk about. Caroline, we hope that you will come back again and we can continue this conversation and delve into even more.
Yeah, absolutely. I'd be happy to swing by anytime.
Awesome. Well, thank you so much. Thank you, Cassandra, for riding shotgun with me.
Mm-hmm.
And we just thank you all so much for listening. Please remember to rate and review, subscribe to the podcast if you haven't already, and help us to spread the word. And remember that God loves you so much, and so do we.
Thank you so much for joining us for this Springs in the Desert podcast episode. If you have a minute, please rate and review us so that we can reach more listeners. Check out our social media pages on Facebook and Instagram, and go to our website, springsinthedesert.org, where you can sign up for our newsletter and hear about more things that we have going on. Most importantly, remember that God loves you so much, and so do we.